Two.
What?
Wait. Oh my gosh. 1,
2, 3,
4. It's like 5. 6.
7.
8.
9.
10.
Are we good? Okay. Imagine you and your friend are out shopping and all of a sudden they fall to the ground because they aren't breathing. Would you know how to perform CPR? I've worked in healthcare for about 2 years now, and you would not believe how many people don't know how to perform CPR. According to a Cleveland Clinic survey, 54% of Americans say they know how to, but only 1 in 6 of those can actually perform it. CPR is one of the easiest things to learn. If you can learn how to administer it, you can save a life one day. Today we're going to talk about what is CPR, why is it important, what are the steps, and how to perform it. Okay. So what is CPR? CPR stands for cardiopulmonary resuscitation. It is a life-saving procedure that is performed when someone's heart stops beating. According to the American Heart Association, if CPR is immediately administered once someone is in cardiac arrest, their chances of surviving will triple. CPR is important because it keeps the blood flowing and it will result in a better, successful resuscitation. There are 5 steps when performing CPR, and they're called chains of events, or chains of survival. So the first one is recognition and calling 911. So if you see someone laying on the ground, you go up to them and you tap their shoulder and say, "Are you okay? Are you okay?" If they don't respond, you're going to check for a pulse and if they're breathing. So you check and see if they're breathing by watching the chest rise and fall. You can check their pulse by putting 2 fingers right here on their main artery and check. And if you don't see that they're breathing or that they have a pulse, you're going to call 911. So once 911 has been called, you're going to see if there's an AED in the area. It's a little device that has 2 chest pads, and you just turn it on and it will just command you to do what you need to do. So you perform CPR and you follow the AED instructions, and you keep doing that until EMS arrive, and once they arrive, they'll take over and take that person to the hospital. So remember, push hard and fast and call 911. Okay, so let's talk about how to do chest compressions. So to do chest compressions, you're going to put your hand in between their nipples, and it's going to be about the center of their chest. And so you're going to place your hand like that right over it, over your other hand. You're going to make sure your elbows are straight and your shoulders are above your hands. You're going to press down 2 inches deep. You're going to do 100 to 120 chest compressions a minute. I've done some CPR classes in the past, and when I would hear that, I would go way too fast and get tired really quickly. So if you just do it at a constant rate, you'll be able to meet those compressions. And so now I'm going to talk about the 2 breaths. So you do 30 compressions with 2 rescue breaths. So you want to make sure the person's head is tilted back and their chin is up so that the airway is open. So when you do those breaths, the breath goes all the way down to the lungs. And the Mayo Clinic came up with this saying so that you can kind of remember CPR. So just remember CAB. It's compression, airway, and breathing. And when you do breathing, make sure you pinch their nose so the air actually goes down and not just anywhere. So hopefully hearing about CPR, you have a better understanding on how to do it. CPR is the difference between life and death for someone. CPR is one of the easiest things you can learn, and by learning you can save a life. According to the Heart, Lung, and Blood Institute, 250 to 450,000 people die from cardiac arrest every year. That's more than breast cancer, prostate cancer, and auto accidents combined. So that's why learning CPR is so important. That's it. Ooh, thank you.